Try
Okay,
first to
all right,
record,
it's fine.
see if it's working.
All right, hello everybody. Welcome to Nevada State University School of Nursing Quality Improvement Initiative. My name is Alex.
My name is Hygiene.
My name is Monica.
And this is Joe.
So today we're going to be presenting on how to increase hand hygiene compliance among nurses. So just to give a brief overview of what we're going to be presenting on today, we're going to be talking about why hand hygiene is important in healthcare settings. We're going to be talking about the cost of not doing appropriate hand hygiene practices. We're also going to talk about the current evidence-based practices and guidelines that the World Health Organization has set up to guide us on what practices we should be using. Then we're going to briefly talk about actual compliance in the healthcare setting, especially here at Henderson Hospital, propose some interventions, and then summarize the key points at the end. So our problem statement, which we want you guys to keep in the back of your mind throughout the remainder of the presentation, is how do we increase adherence with hand hygiene according to the World Health Organization and CDC guidelines? So why is hand hygiene important? As healthcare professionals, and especially nurses, we know that patient safety is the top priority. Everything we do should have our patient safety and health in mind. But on the flip side of that, healthcare worker safety is also important. And when we compromise our safety by not performing hand hygiene appropriately, not only does we get more sick days and we're out of work, but that also reduces the quality of care that the patients are receiving. So another reason is infection control. As we know, hospital-acquired infections are a growing problem here in America, especially in the healthcare system. So hand hygiene compliance is directly related to our rates of infection control. In addition to that, operational costs are something to think about from a broader perspective. Typically, since we work on the floor as nurses, we see the direct outcome that we have on our patients, but when you look at it from a bigger view, bird's eye view, it costs the healthcare system a lot of money each year to pay for the medical treatment related to hospital-acquired infections. And of course, it promotes better client outcomes, and we get better audit scores by the Joint Commission when they come over and regulate. So cost is more than money, it's also health. The hospital-acquired infection rate is inversely proportionate to the hand hygiene compliance. What that means is when hand hygiene compliance goes up, the hospital-acquired infection rates go down, and vice versa. So it's been studied numerous times, and it's very important to keep that in mind. One study in 2015 found that when the hospital-acquired infection rate was around 4%, the hand hygiene compliance was high at about 64%. 3 years later, when they came back and reviewed again, 2018, hand hygiene compliance decreased to 54%, but the hospital-acquired infection rate increased by 3%, all the way up to 7%. So that's a statistically significant increase. From that broader perspective, again, the U.S. healthcare system spends about $28 billion annually directly on patient care related to hospital-acquired infections. So if they get a UTI from a catheter, or if they get PICC line, central line associated infection, we spend about $28 billion on that. But when you factor in the loss of productivity and the mortality rates of the patient, it actually ends up being an indirect cost of about $40 billion every year. So without further ado, I'm going to hand it over to my teammate, Shin.
So when to use hand sanitizer is before and after patient contact and before moving from a soil body side to a clean body side on the same patient, and before handling medication or food, and after remove of gloves, and after touching your face, your hair, and other contaminating items. Here's a video shows like how to properly use a hand sanitizer by World Health Organization.
Please note that this technique is not appropriate when hands are visibly dirty or after using the toilet. In these cases, hand washing is required. Hand rubbing should take you 20 to 30 seconds. Use a timer or count 1, 2, 3, 4, 5 in each of the following steps. Apply a palmful of alcohol-based hand rub in a cupped hand, enough to cover all surfaces of the hands. Rub hands palm to palm, then rub right palm over the back of left hand with interlaced fingers and vice versa. Rub again palm to palm with fingers fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm and vice versa. To clean the tips of your fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm and vice versa. Once dry, your hands are now clean and safe.
So in the video, the World Health Organization did not provide a hospital-required hand sanitizer. So for this time, I'm going to use the hospital-required hand sanitizer and the wall to properly to demonstrate hand sanitizer. So get a good amount of hand sanitizer and rub it from the back. So the tips of the fingers for 20 seconds. So when to wash your hand with soap and water, it's like before performing any clean and sterile procedure, or before eating or touching food, or when you see your hand is dirty, and after contact with blood or patient's fluids, and after contact with microbes, and after using the restroom. So here's a video how to properly wash your hand with soap and water by World Health Organization. And that'll be all for my part. So now I'll pass to my teammate Monica.
Okay, so I am going to talk about the current hospital practices. We've broken it down into 3 different categories, including leadership, the staff ratio, and current policies and procedures here at Henderson Hospital. So just to scratch the very surface of what leadership entails, it includes doing trainings, policy making, awards, auditing, things like that. When leadership makes different policy changes, we as staff follow those changes. Now to talk about the patient to staff ratio, for RNs, it is currently 1:6, which is a change from 2022. Now what happened in August of 2022? There was a nurse walkout here at Henderson Hospital where the nurses refused to clock in. Why? Because they felt that taking on 8 patients when they were normally assigned 5 was unsafe for these specific nurses. So the CNO, the CEO, nurse managers, they all came in and helped out with that unit. We have seen the hospital leadership change and the ratios decrease. So like I said, now it's 1:6, maybe 7. We have also seen in the past couple years the amount of patients that NAPs and CNAs take on. Before, it could have been up to 17 patients within the last year. However, it is currently up to 14 maximum. We also see volunteers on the unit, and they come around, they help provide beverages for patients, they bring little balloons, they answer call lights, they see what else needs to be done. So we do have support staff available. However, factoring in the RN to patient ratio, we know as per policies and procedures at Henderson Hospital that an RN is supposed to be performing hourly rounding. So that gives you 10 minutes per patient per hour, not including the time it takes to round with the provider, because that is now a newer thing that Henderson Hospital is doing. They round with the provider, and you have to take on discharges, new admissions, go to the Pyxis, go to another Pyxis, etc., etc. So, in reality, it's a lot less than 10 minutes. You have probably less than 5 minutes per patient. The policies right now, we touched on them a little bit, and they are really good. They follow the WHO guidelines. This is the article and another article of the walkouts. So hospital compliance. We as student nurses have been coming to Henderson Hospital for med-surg for 7 weeks now. So that is 7 clinical days. We have observed 28 nurses in that time. Out of 28 nurses, only 6 of them really complied with hand hygiene. That equals a total of only 21% of nurses complying with hand hygiene. Why are these nurses not complying with hand hygiene? Well, that could be said that they lack supplies, they get skin reactions. A lot of nurses feel that at the end of the day, their hands are super cracked, they're bleeding, they have no time. When someone wants to skip out on time, cut corners, hand hygiene, it's fast, it's easy, that one can go away. And it could be seen as ineffective. How can we promote hand hygiene compliance? Well, it kind of stems down from the leadership, regular training, and of course the client to staff ratios. Now I'm going to pass it off to my teammate Joe.
Thank you. Hello everyone. I'm going to talk about how to increase the adherence into hand hygiene, and that's through education and training. We just do more training for nurses, even though they've been doing this for a long time, but we have to do something to improve this. And it could be through flyers, it could be stickers, for example, things on top of the sink, wash your hand please as you're leaving, or things on the wall, or maybe since there is lack of materials and those rooms were designed to have 1 bed and right now they're having 2 beds, so maybe they need to put hand sanitizer underneath on the side of each bed, and that will make it more accessible, easier. And maybe do posters on the walls, which we have one I'm going to show you very soon. Things just to keep reminding people, because some nurses, for example, complain the fact that this hand sanitizer might crack their skin, so that's why they don't use it. And maybe the hospital can do something about this by adding lotion or something like moisturizers on the side here and there. And that's it for me. Alex is going to wrap this thing. Here's the flyer I just mentioned, and I can email it to you or print it out if you want it.
Okay, so in summary, we talked about why hand hygiene is important. We touched on the cost of improper hand hygiene to both the patient and the healthcare system as a whole. We talked about the current evidence-based practice on protocols on how we should perform our hand hygiene, both with sanitization and with hand washing, and the appropriate instances to do both. We touched on the compliance rates in general in healthcare, but also here specifically at Henderson Hospital. And then most importantly, we proposed some interventions on how to increase the compliance rates of the hand hygiene. So to drive things home, we just wanted to remind you that despite having low compliance rates here at the hospital, instead of looking at it pessimistically, we can look at it as a glass half full type of scenario. We're not here to shame, but we're here to look for areas to improve and improve our practice always as nurses, because it not only promotes patient outcomes by decreasing their length of stay, increasing their overall patient outcomes at the end, and decreasing the cost to the healthcare system as a whole. So as a takeaway for this presentation, we just want to remind educators, nursing staff, administration, that working together with the staff nurses on the floor, that we can make a better healthcare system for both workers and patients as a whole. Oh, it wasn't recording. I'm just kidding.